Where would you go if you were feeling unwell or wanted to refer yourself for health and wellness support? If you needed a repeat prescription or want to book a GP appointment, the answer is to go to shwh.co.uk, because the Sunderland Health and Wellness Hub has all the information, advice and links you need about local healthcare services in Sunderland, and it'll direct you to the right healthcare services for your needs. So for all your health and wellness needs, visit shwh.co.uk.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hello and welcome to Our People podcast. I'm Harry Newhouse, and on today's episode we'll be talking to extended scope practitioners Jill Clark and Catherine Johnson. Jill and Catherine have been working very closely on the launch of a new platform called Move With Me, which helps those who suffer from musculoskeletal conditions. Jill and Catherine will be talking about what the platform does, what it has to offer, and how it helps our patients, staff, GPs and many others in the region. Welcome to the podcast, Jill and Catherine.
Thank you very much. Thank you.
Firstly, Jill, can you please explain a bit about your role here at the Trust and what it involves on a daily basis?
Yes, thanks for inviting us to do this, first of all, Harry. I am one of the extended scope practitioners in the service, so my role is largely clinical, so we see patients face to face. It involves the assessment, treatment and diagnosis of patients. There's also a little bit of triage involved in that role, so when the referral comes into the service, one of the extended scope practitioners or senior clinicians will look at that and decide where that patient needs to go, so we get them to the right place at the right time in front of the right person first time. And
Catherine, I presume you have a similar role here at the Trust, but do you work on anything different to Jill, and can you explain a bit about how you were both involved with the Move With Me platform?
Yeah, so the short answer is no. I pretty much do exactly the same clinical role as Jill, though I'm nowhere near as experienced. So I'm a full-time clinician. I don't have any non-clinical role within the service. How did I get involved with Move With Me? I think I got strong-armed by Dr. Glenn Ray, who's been on one of your previous podcasts. So myself and one of the physios, Joe, had previously been involved in updating the old website and trying to promote SIMS on social media through various platforms such as Twitter and the Trust Facebook page. And then when we obtained the funding for the Move With Me project, we were asked to be involved in regards to making the videos, doing the voiceovers for the exercises. So it was very much a practical and hands-on side to developing Move With Me.
We have previously talked to members of the Sunderland Integrated Musculoskeletal Service, or as you mentioned there, SIMS, here at the Trust in a previous episode, which can be found on our YouTube and Spotify channels. On the episode, the team explained in detail what the service does and what MSK is. However, could you briefly explain what musculoskeletal is for those that might not have listened to it yet, and what are the type of conditions people struggle with?
So musculoskeletal covers the joint, muscle, nerve, ligaments, tendons, structures in the body, and we see everything from head to toe, and a varying age range as well. So our service starts from 16 up. So anyone that has joint pain, soft tissue pain, nerve pain, can be referred to us via their GP.
As mentioned earlier, you have both recently been involved in launching a self-help tool called Move With Me, which helps those that suffer from MSK. Could you tell me a bit more about Move With Me?
Yeah, so Move With Me has been developed as an online platform to help improve the way that patients can do their exercises. We're trying to facilitate them to be able to self-manage or progress their rehab as best we can. So it's based on the website, and it's made up of videos with voiceovers and also written text, so the patients can visually see the exercise, hear the exercise being explained and read the exercise being explained to allow them to do their rehab at home. And the physios are able to make sure the exercises is tailored to that patient, so it's a very individual specific rehab programme per patient, which is designed just for them.
There's also a diary function on there as well, so the patient can track and monitor their progress using a traffic light system. So if they found their rehab particularly hard, they would mark it as red. If it was okay, not too bad, it would be marked as amber, and then if it was easy, it would be marked as green, and then that can be reviewed by the clinician as well, so that can be tweaked accordingly depending on how the patient found it.
And how does this benefit patients?
So not only can they track their progress, which helps with, I think, motivation in the patient taking autonomy for their own care, but also they've got the reassurance that they're doing the exercises correctly. So quite often you can give a patient an exercise and they've been doing that for a 2, 3, 4 week period, but maybe the technique isn't quite right. So it gives them that reassurance that they're doing it correct.
And we're also using Move With Me to collect data through another program called Outcome Predict.
Yes.
So patients have got the option to consent to having outcome measures sent out to them at home, which they fill in at baseline, 6 weeks, 12 weeks and 24 weeks. So that enables the patient to kind of report on their progress and whether their symptoms are improving or not. And then we as clinicians get feedback from that so we can see whether the patients are getting better or not.
And how does the platform help health professionals in the area?
So if for primary care colleagues, it gives them that support and consistent sort of self-help information that they can then offer to patients. So we know that the information on there is correct, up to date, and what the patient should be doing depending on what their MSK problem is.
And not just clinicians within our service, so lots of the GPs in Sunderland are now directing patients towards Move With Me, so they can actually gain some advice and guidance on some exercises potentially prior to being referred, so they're doing something in the meantime while they're sitting on our waiting list.
And is it just in the Sunderland area?
So anyone can access Move With Me because it is via our website. So there is a self-registration tool on there, which means anybody can sign up to Move With Me and get access to basic rehab. If the patient is referred into our service and signed up via a clinician, then that rehab programme is going to be more bespoke and more unique to their needs, but there is more general information out there for anybody who's wanting to sign up.
You mentioned there the website. Are there any other platforms to access these self-help tools?
We have posters in most of the health centres that we work at with QR codes on. Most of the clinicians have mugs on their desk that advertise Move With Me with, again, the QR code on, so the patients can scan that and they'll take it directly to the website.
If anyone is not currently within SIMS and wants to access the platform, how can they do so?
So they just need to go to www.sunderlandims.co.uk and there's a sign up here link on the website. That'll give them access to the basic level of rehab so they can get started with their rehabilitation and self-management.
Brilliant. Is it important when patients are at their local GP that doctor refers them to the Move With Me platform?
Yes, absolutely. So it's a site and platform that you can get early access to the appropriate advice and education. So potentially, speeding up that recovery and helping reduce pain quicker and returning to function quicker. So yeah, absolutely. They need to be pointing them all in the direction of Move With Me.
How long has it been since you launched the platform, and has Move With Me been successful?
So Move With Me was launched in April earlier this year, so 2022. It has got over 300 exercise videos on there currently, all with voiceovers, and there's the option of being able to change the language for the subtitles. So that helps with sort of access to the site. In the first month of going live, we had over 85,000 hits on the website, and that has continued to increase. And the last set of statistics I got was September's, and in September we had over 103,000 hits in the month. We currently have over 8,500 diary records, which have been inputted by patients, so it proves patients are on there, they're recording their progress, and that they're using the platform to help with their rehabilitation. So overall, quite a big success, really.
Brilliant.
Yeah.
And how have the wider SIMS team been involved?
Well, apart from taking the mick out of Joe and I for being on all the videos, when we initially started talking about what Move With Me would look like, we obviously looked at what the existing SIMS website was like, and we sent an email out to the wider team just to say, what would you like to see, what don't you want to see, what can be improved. So each clinician had their own input into what specific exercises were their favourites and they would like to have access to then be able to prescribe to patients.
That brings us to the end of this episode of Our People podcast. Thank you very much, Jill and Catherine, for taking the time out of your busy day and joining me today.
Thank you. Thank you.
Thanks for joining us for this episode of Our People podcast. We hope you enjoyed it and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.